Dotson. Did I
Yep.
pronounce that right,
Yeah.
Cambria? Okay,
Yeah.
good.
Cambria.
And Cambria comes to us from kinesiology and orthopedics and works with Dr. Michael Samanen?
Saman.
Saman. All right, are you ready?
Yep.
All right.
All right. Share my screen. Okay. Hi, everyone. My name is Cambria, as we said just 2 seconds ago there. So I've been working with Dr. Saman for about 18 months now in his lab, where he focuses a lot on FAIS is where he's getting a lot of his grant money for and everything. So that's where his focus is. So about 18 months ago, I came to him and wanted to help out with his projects. And so we ended up coming with an individual research project for me to do as part of my honors capstone, which I made this poster here for. So to give you a little background on FAIS, it's short for femoroacetibular impingement syndrome, and it pretty much is like a small bony growth on the hip joint that causes pain in some individuals. And so what I dedicated this research project to was trying to find the pain causation in these patients diagnosed with FAIS. And so after thinking about it for a little while, we had come up with the hypothesis that when compared to healthy control patients, the patients with FAIS will exhibit a weaker hip extensor and abductor strength, as well as a smaller gluteus maximus and gluteus medius, which I'll shorten as Gmax and Gmed for the rest of the presentation. They'll have a smaller cross-sectional area and volume, and cross-sectional area will be CSA throughout the poster here. So we know that these patients show a weaker hip strength, and that's a lot of the reason that they're having pain. So what I did for a lot of last year primarily was work on these muscle segmentations that are down here in the left-hand corner. So on the left here is the gluteus maximus, and on the right is the gluteus medius. After looking through some literature, we determined the best place to segment these was for the Gmax, just clear the femoral head, which would be right here as a little white bony part. And for the gluteus medius, it's the inferior point of the sacroiliac joint, which is going to be found right over here, if you can see my mouse. So over here is a lot of our patient demographics and how we sorted into this project. So our methods really consisted of, number one, me segmenting all these muscles. And in order to ensure that this was going to be a reliable study, we conducted a dice coefficient, which pretty much takes the two pictures and lines them up on top of each other to make sure that they're the same. And so the closer that number is to 1, the more reliable you are. And so I got a dice coefficient of 0.98, which is highly reliable. So we were ready to move forward with the project. After these segmentations were complete, we have an in-house software that we use on MATLAB that produced for us those cross-sectional areas in centimeters squared and the volume for us in centimeters cubed. And so we took all that data and we needed to compare it to something strength-wise. So we took our isokinetic hip extensor and abductor muscle strength that were measured at an angular velocity of 16 degrees per second, and they were normalized by body mass. So for the results section we got, as you remember, my hypothesis was that a smaller muscle is the reason for a smaller muscular strength, which we can see down here, the muscular strength is much weaker in those patients. So the darker blue on the left-hand side of these graphs down here in the middle shows the control patients. So these are people that have no symptoms, no pain, and you can see that their strength in both their hip abductor and hip extensor strength is much higher. The hip abductor strength is statistically significant and the hip extensor strength is marginally significant. So obviously you can see here that the strength in these two motions is much weaker. However, when we move over here to these graphs on the right-hand side, we examine the cross-sectional area and the muscle volume comparison. So when it comes to the cross-sectional area, surprisingly for the FAIS patients, they had a larger area when it comes to the Gmax and just a slightly lower area when it came to the Gmed. Nothing statistically significant between the two, which was actually surprising. And even more surprising is when we move down to muscle volume here, you can see that the FAIS patients, they actually had a larger muscle volume in comparison to healthy controls. And so Up here are some of the p-values that show those differences for these muscle strengths. And as I stated earlier, the statistic significance here is really important, and the fact that there is no statistic significance here is also important. Pretty much what that just means is that there is a reason that the muscle strength is weaker, and we just don't have the right reason why. So we rejected our hypothesis. And what we're going to do next is actually, instead of looking at the size of the muscle, we're going to go in and look at the composition of the muscle. And so what I mean by that is Dr. Saman has a colleague who is working on a fat infiltration algorithm for us that we're going to input into MATLAB. And then from there, MATLAB will plug and chug for us and give us the density of those hip muscles and what part of it is fatty tissue and what part of it is healthy tissue. And so our next hypothesis is that despite them having a larger muscle size and weaker strength, we think that the weaker strength is due to a poor muscle quality. So that's where we're going to go with the project from here. Dr. Simon has been working on this for a very long time. And so I wrote down here in a lot of acknowledgments to all of his lab members and his grants. And I know a lot of my family's on here too. So I just want to say thank you to you guys for supporting me too. Anybody have any questions?
Fantastic presentation.
Thank you.
I absolutely understood that.
Yeah.
You did a great job of breaking it down, kind of, as we say, to layman language.
Yep.
Right? So good job.
Thank you.
Cambria. You're welcome.
I agree. You did a really great job. Sorry, Evie.
No, you're fine. Go right ahead.
I am wondering a few things about FAIS because it's not something that I'm familiar with, which means I don't have it. It's one of those medical conditions that you know a lot about if you have it. So is there a genetic component? Is it because of an injury? How do people acquire this?
So I know Dr. Saman can answer a lot more about this than I can. But from what I know about FAIS is it happens in all populations and especially in a lot of younger populations. So a lot of people after sports. And that's something, it can be like you may have it and you just are unsure because it's not causing you pain. Whereas in the people where it causes pain, they go and they look for information on how to make that pain stop. And a lot of times it ends up in surgical intervention, which is a big primary part of Dr. Saman's study is he's looking at their pain beforehand and then a year after surgery. So we currently have some patients that are included in this data here who are going to be going through that surgical intervention. And then we're going to test their muscular strength and all that after as well.
And as a follow-up, how painful is this for the person experiencing it? Are there wide variations in pain level or is it debilitating?
It can be really debilitating. We've had a couple patients come in that could barely walk for our, some of our things. It can be really painful, especially on the different muscles that we test. So one of the muscles that we test, they're supposed to push their leg out. And if it's on that hip side, it's just that bone on bone. And so a lot of people that maybe have had some kind of knee replacement, they know what that bone on bone feels like. And it's rigid and hard. And so it can be really debilitating for some people. Whereas for others, it may not be as debilitating.
So you're working directly with patients?
Yeah, so I do data collection with Dr. Saman's lab group. And so as right before COVID, I was doing a lot of it as well. But yes, we would have people come into our gate lab in MDS here on UK's campus, and we would run them through a series of protocol.
And I mean, that's an impressive experience as an undergraduate.
Yeah.
Certainly. So what have you learned from working with people who are experiencing pain, and how has that affected either your passion for the research or just anything about how have you changed how you approach them? Tell us a little more about that.
I'm a senior this year at Kentucky, currently applying to medical schools. And so my passion is within orthopedic surgery. So I have been in an orthopedic surgeon operating room. I followed one around for clinicals and stuff. So that's what really drew me to Dr. Simon's research when I was looking into getting into some kind of research, is because he was working with patients live and on a joint, which is primarily what I want to work with in the future. But I do think that my patient skills have really improved over the past year or so. But I think the biggest takeaway that I got from this is that I do want to continue research. I started out as a biology major here and did not like all the lab research that we were doing with pipettes and all that. But transferring to kinesiology and working in this kind of lab environment really sparked my love again for research and wanting to work with people hands-on for the rest of my life.
That's awesome.
Thank you.
See, that just goes to show. I have one question for you, Cambria. Did your mentor, did he look at, you said they were a lot of younger people, sports athletes.
Mm-hmm.
Has he looked at the different sports? Like the first thing that comes to mind to me is golf.
Yeah.
Because you walk 18 holes.
Right.
You're constantly swinging. You're using your hips constantly.
Yeah.
And I just wondered if that was anything that is that a core group of people that you saw, or not necessarily?
I don't think that we are really looking into demographics in that kind of sense. I think we're looking more within age and
Gotcha.
weight and how that is affecting their pain scales.
Yeah. I just know a lot of golfers have hip
Yeah,
replacements.
it would be really interesting. Like I said earlier, it's a disease that you may have and you're not sure because it's not causing you pain. If I had all the money in the world, I would scan every single person and really get a good number on how many people truly do have FAIS.
Yeah. Interesting work.
Yep.
All right. Well, if no one has any, does anyone have any other questions?
I don't see any in the chat yet.
Okay. Well, again, great presentation, Cambria.
Thank you.
Good luck
Thanks.
to you. I'm sure you're going to be a fantastic orthopedic doctor someday.
I sure hope so.
And Godspeed to you in your future.
Thank you. You guys have a great day.
Thank you. This actually concludes